local, late breaking. This is KEZI 9 News Midday with Sean Cuellar and meteorologist Dave Holder.
Check your calendar. It is April 9th, which means it's time for a segment KEZI 9 Checks In. It's a monthly reminder on the 9th of each month for women to do a self-breast exam to check for any lumps or changes. But today we're also talking about another issue that affects a lot of couples, infertility. Here's KEZI 9 News anchor Renee McCullough.
Joining me now is Dr. Austin with Women's Care, and Dr. Austin works at the Fertility Center of Oregon and is an expert on women's health in Eugene. And Dr. Austin, how common is infertility in men and in women?
It occurs in about 10% of couples.
What are the signs that you could suffer from infertility?
So most couples actually try on their own for a period of time. And if the woman is less than 35 years of age, we ask her to try for about a year, making sure that she has a good opportunity to get pregnant each month. If she has not, then we would ask her to come in and have an evaluation. For women over the age of 35, we shorten that to just 6 months.
And what causes infertility?
It's about 2/3 of the time it's a problem with the woman's system, about 1/3 of the time it's with men.
Okay.
For women, it has to do with ovulation or surgical problems. Sometimes age gets in the way. For men, it's generally having to do with poor sperm counts.
What increases the risk then?
The major increased risk happens with aging for women. So as women get older, their fertility declines significantly. It's pretty stable through the late 30s, and as the 40s approach, it precipitously declines. So that by the age of 40, 41, 42, most women will have very little residual fertility.
What are the options for women or men who are having trouble?
So the first thing we look at is the cause of the infertility. So a preliminary evaluation has a number of steps to it. The first is for men to do a semen analysis so that we can just look at numbers and functionality of sperm. For women, it's much more complex because women's system is much more complex. So we first assess whether the quality of her ovulation is ideal. Then we look at her anatomy to make sure that all the parts that are necessary for having a successful pregnancy are there and that they're working well.
In this day and age, there's lots of options, I'm sure, for women or men who are having trouble.
Lots of options. Pretty much for all couples, if they're willing to use technology and maybe compromise some way they come into this about what their family's going to look like, everyone can have a baby.
So what is your advice then if people are at home and they're having trouble? It's got to be hard maybe for a woman or a man to come in and say, we need help.
It is. It's probably the biggest impediment to people getting help is actually asking for help. Most couples who are having a difficult time know they're having a difficult time, but because it is such a personal, private part of our lives, a lot of people don't even talk with their doctor about it, and so they don't get an appropriate referral for more advanced infertility care.
But they should at least try because there's plenty of options out there.
Absolutely.
All right, doctor, thank you so much for joining us today. And for more information, you can go to our website at KEZI.com, where we have a link to the Women's Care site.
Not only that, Renee, you can also check out our website to sign up for KEZI 9 Checks In. We're going to send you a reminder each month to do your monthly self-breast exam.